live streaming discussion about religious intrusion on women's health care. I'm Sivia Tamarkin. I'm the director and executive producer of the film Birthright, and we're delighted to have you here today. It's an important discussion, and it's on a particularly auspicious day when women around the country have been protesting the restrictions on women's reproductive health care. Alabama, certainly, and the restrictions in Georgia and Ohio, Missouri, that have appeared on the horizon in recent weeks, but have been long in the making. I wanted to mention that, and I'm wearing my handmade pin, because this is all about religious control of women's bodies, women's privacy, and a woman's right to make her own medical decision. It's the grip of religious extremists as they have taken over our state legislatures, as they have worked their way into national politics and indeed into the administration. So while the war is going on in the courts, in the legislatures, in the administration, and in the policies of the Department of Health and Human Resources, which now recognizes a physician and a hospital's right to refuse medical treatment on the basis of their own particular religious beliefs and convictions. One place that this has been going on for a very long time is in Catholic healthcare. Catholic healthcare, Catholic bishops consider their hospitals an extension of their mission and their philosophy and their beliefs. And it is there because of the mergers and acquisitions over recent years and the bankruptcy and lack of financial viability of so many private and public hospitals that Catholic healthcare has now tightened its grip across the country, so that 1 in 6 acute care hospital beds are either affiliated with or owned by Catholic healthcare. And in some states, that number is greater. Some states, it's 40% of all beds or 30%. It has posed a problem for healthcare, particularly for women's health care, because what dictates the rules of practice for Catholic hospitals and their providers are the ethical rules and the doctrine established by the U.S. Conference of Catholic Bishops. And these ethical religious directives ban most reproductive health procedures. Certainly they ban abortion, but they ban contraception. They ban infertility treatments. They ban tubal ligations, vasectomies. But they also, beyond reproductive health, they also do not always recognize end-of-life DNRs. So that's the context in which we're having this discussion today. And these healthcare facilities have become, in many areas, monolithic. They thrive on taxpayer funds, on grants, because they're nonprofit, on urban municipal grants, county grants, state grants. They receive Medicaid and Medicare, but they do not practice standard evidence-based medicine. And yet, many of these large systems draw in billions of dollars. If you were to weigh them on the scale of Fortune 500 companies, they are bigger than Pepsi-Cola, than Starbucks, than Facebook, than Southwest Airlines. And they are, for many people, the only provider around. So that is the context in which we are having our discussion today. I am delighted to have on our panel Amy Littlefield, who is an investigative reporter for Rewire News, where she focuses on the intersection of religious beliefs and healthcare. We have Carmen Rios, who is the digital editor at Ms. Magazine and co-host of Trigger Happy, a weekly web series tackling sexism in politics and pop culture. And we have Kira Shepard. She is the director of the Racial Justice Program of the Law, Rights, and Religion Project at Columbia Law School. And she is one of the co-authors of a recently released study called Bearing the Faith, the Limits of Catholic Healthcare for Women of Color. So welcome to our panelists. I would like to throw it open to you and have you all make it sort of an introductory comment about Catholic healthcare, the impact you have seen, and whatever anecdotal comments, and then we'll open the discussion from there. So why don't we begin? Amy, why don't we start with you? Because you have the broader scope of coverage. Okay.
So, I've been covering Catholic hospitals for the past 3 years at rewire.news, and there's a few stories that really have stuck with me in terms of the dangerous and even potentially life-threatening circumstances that can happen to patients who end up in a Catholic hospital, which, as Sivia mentioned, can happen because it's the only hospital in town. It's where the ambulance takes you. It's the only place where your health insurance will cover your care. I reported on a case a couple years ago that still really sticks with me about a doctor named Jessica Ralph in Milwaukee, Wisconsin. She was working in a Catholic hospital, and a patient came in the process of losing a twin pregnancy at 18 weeks. And while she had miscarried the first twin, the second one still had a heartbeat, and the pregnancy loss was inevitable. The fetus did not have a chance of survival. But because the hospital followed these Catholic rules, the doctor couldn't take action until the patient got sick enough that she met the standard in that hospital for her to be able to end a pregnancy. So she had to actually sit there for 10 hours and watch this patient and wait for her to get sick until she had a fever that suddenly spiked to 102 or 103 degrees. And then she was sick enough that Dr. Ralph was actually able to intervene and end her pregnancy. And unfortunately, it didn't end there because this hospital was not set up to provide the standard of care for abortion in the second trimester. The patient actually had to have labor-induced labor for more than 24 hours. She actually had to have a blood transfusion. All of this because she ended up at the Catholic hospital, which was in a primarily Black neighborhood in Milwaukee, and not, a few minutes away at a secular hospital where the minute she walked in the door, she would have been able to have an abortion and end her pregnancy safely without having to, wait until she spiked a fever and was at risk of a potentially fatal infection first. So that's just one, example. And I think stories like that are taking place all the time, and we're not necessarily hearing about them in this growing number of hospitals that are influenced by Catholic doctrine.
Kira, in your study, you followed, I believe, 33 states. You examined the healthcare practices in 33 states and Puerto Rico, one territory. Tell us about it. Tell us what you discovered in your research.
Yeah, so we looked at 33 states to find out if women of color disproportionately relied on Catholic hospitals in those states, and we found that that was the case in a number of states, like 11 states. We saw striking numbers, 19 states in all. So more.
But let me interrupt you. Those numbers are astonishing. I mean,
the numbers are astonishing. Yeah, and I think the numbers are important. I think the overall thing that we were trying to get across with the report is that because of the racial and healthcare disparities that women of color, particularly Black and Latinx women, already face, it kind of exacerbates and compounds the harm that the directives cause. So, for instance, in the report, we talk about the fact that studies have actually shown that doctors believe that Black women can withstand more pain. So when you're talking about situations where you have situations of miscarriage, mismanagement, like you do in Catholic hospitals, where the healthcare providers don't evacuate the uterus when they should, according to standards of care, because they hear a fetal heartbeat. A lot of time, the women who are miscarrying at that time, they're in a tremendous amount of pain. So a lot of us have heard the story of Tamisha Means, who went to her community hospital, which was a Catholic hospital, and was turned away 3 times. But the first 2 times, the doctors only gave her aspirin to deal with her pain. So in cases like that, where you need the doctor to really have compassion for the patient, in cases with Black and Latinx women who don't have as much social capital as white women, you won't get that type of care. And actually, studies actually show it. And we talk about other health disparities as well, like Black and Latinx women have higher rates of unintended pregnancies. So when you have situations like the rise of Catholic hospitals and a number of tubal ligations across the nation going down, which a study has recently showed, this is going to impact Black and Latinx women more so than white women. And then you have, lastly, I'll say, situations with women of color, Black, particularly Black, Latinx, Native American women who actually have lack access to care. So they have higher pregnancy complications. So we have higher pregnancy complications. You're going to need a higher standard of care. You're not going to need to be put in a situation where you could be discriminated against and refuse care because of a set of religious directives. So we wanted to shine a light on the states where we were seeing women of color disproportionately rely on Catholic hospitals, and then we wanted to bring in all these other factors that make this discrimination so much more worse for women of color, particularly Black and Latino women.
And let me just interject here before we go to Carmen. Mm-hmm. Can you tell us, is there a pattern? Are more of these states in the Midwest? Are they East Coast? Are they just randomly scattered around the country? What about in the Southern belt? Or we're seeing it everywhere.
Yeah, we actually thought when we initially decided to do the report that we would see this pattern more in Southern states, but actually just there's no logic to it. It's just like everywhere across the nation, basically.
Carmen, why don't you address what you have found and what you're aware of, particularly in the Latinx community, if you might?
Totally. Well, I mean, I think my background and the work that we do at MIS has also been sort of about less specific and more broadly sort of covering the Catholic Church's organized efforts to not only deny care within their own facilities and to women in their own communities, which we've seen with sort of, lawsuits about contraception against schools like Notre Dame, who don't want students or employees to have access, as well as the women who are accessing care at these hospitals. But even more largely than that, the impact that the U.S. Conference of Bishops and organizations like the Knights of Columbus have on politics and policies that are shaping women's lives, and the fact that, that Title X, the only program dedicated to sexual and reproductive health care for poor women, has been in many ways dismantled by the impact of bishops who have successfully lobbied to make it medically inaccurate and abstinent focused, and to deny patients contraception and comprehensive care who are using those programs. And, I think even more broadly that on the global scale, we sort of see that it is a very targeted effort in which the Catholic Church will embed itself into a community by providing these services that are really critical, such as medical care, and in countries elsewhere, even stuff like medicine, food, water. And then once they've sort of built that trust, then they go in and start working with lawmakers to effectively just start dismantling women's access to comprehensive family planning. And I think, we do see that women of color feel it worst and first, because that's just sort of, I think, part and parcel of the lopsided structures that, you know, women of color are functioning in, which is that they already have a disproportionate lack of access and options and information.
Well, I think what's interesting to note is that Catholic hospitals have so strategically positioned themselves. They have positioned themselves in urban areas where there may be a shortage of hospital providers. And then they come into city councils, county commissions, and they say, here we are, the rescuers. So they get grants, they get all kinds of funding to set up these facilities. And the patients who utilize the facilities in the neighborhood oftentimes are patients who rely upon Medicaid. And they don't have choices to go to other hospitals because this may be the only provider that takes Medicaid in that area. But the irony, of course, is that they are welcomed into these communities and then they do damage, serious damage, and put lives at risk because of it. Let's talk a bit about how they are able to do this. A question that many people always ask is, how can they get away with not practicing standard evidence-based medical treatment for something like miscarriage mismanagement? Are patients aware that they are being refused standard procedures when they go to these hospitals? Kira?
There are federal laws and state laws that protect them, that basically says that healthcare providers can refuse services based on their religious beliefs. And as far as notice, I think that's one of the big issues. And I think a lot of advocates are working on that now, just like saying, okay, Catholic hospitals, you can abide by these religious refusals and these directives, but you have to at least give patients notice, which seems like a very small thing to ask, but we're getting a lot of pushback from Catholic hospitals and from the Catholic Church. But yeah, studies have shown that a lot of patients aren't aware, one, that the hospital is a Catholic hospital, because a lot of times with these mergers, the name might not even appear to be a Catholic hospital. And even if they know that it's a Catholic hospital, they don't know that they follow these ethical religious directives that allow healthcare providers to refuse so many different services, especially reproductive healthcare services. And I think it's also important to also know the impact that Catholic healthcare has on the LGBTQI community as well. So there's been a number of cases in recent years where our trans brothers and sisters have been refused gender affirming care at Catholic hospitals. So this is a very important thing, but that's not happening.
There has been, in fact, there have been some lawsuits that the ACLU has taken up in recent years. There was a transgender man who had an appointment, who already was scheduled for hysterectomy surgery, arrived at the hospital, and, literally at the 11th hour was told, nope, you cannot receive this surgery. Mm-hmm. So it does definitely impact the LGBTQ and the gender nonconforming community, very much so. Mm-hmm. What's interesting is also, let's talk a bit about doctors and how many of them are caught between when these mergers occur. Who would like to jump in on that?
Well, I don't know. I can't speak as much to like the individual experiences of the doctors, but I do think something I've been thinking about that Kira had touched on is this idea of protecting religious freedom, which is something that we're seeing growing as sort of a concept right now under the Trump administration, but obviously didn't start in the last couple of years. And I just do think it's interesting how the Conference on Bishops and sort of the church as an organization has really flipped this narrative of it's our religious freedom to deny care, when the truth is, 77% of Catholic women support copay free birth control. We all know a majority of Catholic women support abortion and birth control access, and that you're not necessarily a Catholic person in the hospital bed. So I do think, I think it's appropriate that you're wearing your handmade pin, because I do think there's this narrative that they're succeeding in making the dominant narrative, and our lawmakers are helping them make that the dominant narrative of it's unfair to expect the Catholic Church to provide services that aren't in line with their mission or values. But in reality, what they're doing is they're saying we want to have religious control and exert religious control over the bodies that are under our care. And I think, we also know that anti-abortion legislation often includes scripting doctors, and that doctors already, even if they're not in a Catholic hospital, an abortion provider anywhere in many states could literally be in legal trouble for telling a patient the truth about whether or not abortion is dangerous or whether or not it's an option for them. So I think it is interesting to see how the church's sort of work has been successful in that area.
Well, and that falls under the Trump domestic gag rule as well, in terms of the referral that doctors are now become prohibited from giving. But what I wanted to point out a little bit is that, it's been our experience, and we document in the film, the conflict that many doctors have when their hospital and their practices, their group practices, are taken over by Catholic healthcare. There's a level of denial. Well, nothing's going to change. We'll be able to practice the kind of medicine that we've always been able to practice. And so they have to sign on in cases to the ethical religious directives, and they do. And then they often realize the consequences after the fact, and have to send their patients in the middle of an emergency elsewhere. Amy, have you come across any cases like this?
This came up recently. I reported recently on a Catholic hospital in Waterloo, Iowa, that had, for decades since the 1980s, had a workaround, which is a common thing that healthcare facilities will establish to sort of recognize that it's not going to be so popular, and it's not going to probably allow you to stay in business if you don't provide birth control, for example. And so they'll find creative ways to provide reproductive health care without upsetting the bishops too much. And so this hospital in Waterloo had an area that they called the sin room, where they provided tubal ligations and inserted IUDs and did other evil, in the words of the Catholic Church, procedures that would have been banned otherwise. And it worked out pretty well. It operated almost like any other hospital, even though it was Catholic. But then what happened recently is that the Archbishop caught wind of this behavior and came in and not only said you can't do tubal ligations and vasectomies anymore, which are really evil, but you also have to shut down your contraception program. You can't provide any more birth control unless it's for medical necessity. And, so this affected not just patients in the hospital, but also outpatient, people who were like showing up at the doctor's office or midwife's office where they had been going for many years for healthcare. And on one day you could get your birth control pill renewed, and on the next day only if you had, heavy bleeding or some other medical indication. And I talked to a number of doctors who kind of simultaneously as all these changes have been happening, there was a private practice that was being absorbed by the health system because it's increasingly financially difficult for these private practices to remain independent. So a lot of them are getting absorbed by these big systems, which are often Catholic. And I talked to a number of doctors. One of them just said, I retired early. I couldn't practice medicine that way. She was like, she was used to inserting IUDs, performing tubal ligations, providing the care that her patients needed. And she was like, I can't do my job anymore. Mm-hmm. So she wanted to work for a few more years, but she decided it wasn't worth it.
Yeah. Yeah. And I think
Go ahead.
I just want to quickly say, it's interesting too, because we're saying this is about religious freedom, but a lot of the doctors that work at Catholic hospitals, they aren't Catholic, or if they are Catholic, some might actually believe that abortion is okay. Some actually believe that it's their religious duties to perform abortions. So what about their religious beliefs? The fact that they're not allowed to fully practice their beliefs as healthcare providers because of these directives and other laws similar to them.
Well, what about the oath they took to do no harm? I mean, that becomes the paramount, because it's just that, in some cases, when do you decide? They usually all agree that a woman's life is at risk. There could be an intervention. But as we were saying earlier, at what point do you determine a woman's life is at risk? When she's infected and is running a low-grade consistent temperature, or do you wait until she's in full-blown sepsis and then intervene? We have there was a very well-known case nationally at St. Joseph's Hospital in Phoenix, where a woman who had pulmonary hypertension during the latter months of her pregnancy was in emergency mode, and with this blood clot, and which could have proven fatal. And finally, the managing director of the hospital, Sister Margaret McBride, interceded and said the woman needed to have the pregnancy terminated. Sister McBride was excommunicated. And it shows how, the health of the woman really was not paramount until she intervened. But what is interesting in so many of these cases, going back to the doctors, number one, if you end up doing your residency at a facility like a Loyola University Medical Center or Georgetown, or a huge Catholic facility, you will not get the training to do terminations. And in an emergency situation, if you then become later on an ER physician, or in a situation where you have to perform, you don't know. You haven't had the training. So it's really becoming a national public health crisis. And what I would like to move to address here is that there is definitely a correlation. Study after study has indicated a correlation between reproductive health restrictions and maternal mortality rates, maternal and infant mortality rates. So let's talk about that in the context. Kira, when you were talking about women of color and you talked about what they face dealing with Catholic healthcare, with the misconceptions and outrageous perceptions that they have a higher threshold and tolerance for pain, that everybody knows the famous story with Serena Williams, the tennis star, how she said no one was paying attention when I was telling them about my body in the wake of her delivery, that she felt something was drastically wrong. And in fact, she had a blood clot. Address the high rate of what's happening to women who come to these hospitals for care. I mean, what's being ignored besides the pain level?
Yeah, I mean, so with the maternal mortality, high maternal mortality rates, one thing, a number of different cities have put out commissions to look at what's going on. No one really knows, because when you look at the rates, if you try to account for economic disparities, you see that that's not the situation. So women who are poor have the rates are similar to women who are middle class. So what is basically a lot of people have concluded, or close to concluding, is that just women of color are treated with a type of either explicit racial bias or implicit racial bias when they go to hospitals. And there has been studies where people have interviewed a number of women of color, particularly Black and Latinx women, who say that they felt like they weren't really listened to. They felt like their issues were dismissed by doctors, and it made them not really trust the doctors, and also added to their feelings of being socially marginalized. There was a recent study done by a social scientist by the name of Arlene Geronimus that actually showed that Black women had shorter telomeres, which is the chromosomal markings of aging. They were shorter, significantly shorter than white women, which showed that their lifespans were like 7 years shorter than white women. And she said the reason this was happening was because of social marginalization in a number of different areas in public life, including hospitals, schools, housing, jobs. Just the feeling of being racially discriminated against, which has nothing to do with your economic means. It just has to do with the color of your skin. So Black women and Latinx women and Native American women have been feeling this, and we think, researchers think this has something to do with the high maternal mortality rates, particularly in the Black community, also in the Latinx community. But with the report, we tried to look to see if there were like real correlates. We tried to develop some type of methodology that would show correlations between the high maternal mortality rates and the healthcare refusals. We weren't able to. I don't know if any other studies have been able to show that, but that would be something interesting to see.
Right. Well, what's interesting is that there is a much higher rate of maternal mortality among women of color. I mean, it's double. And
or in some places, yeah.
Higher. Right. I mean, 3 to 4 times, you know. So what's interesting, if someone would study any kind of correlation between the hospitals that cater mainly to, you know, a population that then ends up with such a high percentage of post-delivery deaths. Interesting. Carmen, talk to us a bit more about some of the harm. Let's talk about how this violates the do no harm clause in the Hippocratic Oath. Talk a bit about some of the incidences that you've come across, and then Amy, I'd like you to do the same. Let's stop talking figures and let's talk about real life situations here that people have endured.
Yeah, I mean, and I think it's interesting too, because this conversation happens at the intersection of medicine and policy, right? Those are two fields we know have not typically been very considerate to the needs, lives, and experiences of women, of people of color, of poor people. So it makes sense in a certain way that these really horrifying health outcomes of like abortion restrictions, contraception restrictions, these sort of problematic refusals of care are impacting poor women of color the most, because that's exactly what they're intended to do. I mean, I think, you know, I've been working at Ms. and the Feminist Majority Foundation, which publishes Ms. for now, I'm entering into my 7th year. And I always remember that one of the first stories I heard when I was working in our DC office was that, you know, that my supervisor, Eleanor Smill, who's our president and founder, once took someone who was pregnant but clearly suffering a very serious pregnancy complication to the nearest hospital. Turned out that hospital was a Catholic hospital, and she had to fight them to basically put the life of this woman before this notion that they were just refusing to provide comprehensive care for a philosophical or principle, a reason of principle, where there's like this tangible experience where someone's life is in danger. And you know, when I was doing research for this discussion, I came across a Mother Jones article with a terrifying story about a woman in Sierra Vista, Arizona, who was pregnant with twins. One miscarried during delivery, and then she was rushed to the hospital because she was severely bleeding, and they were like, we cannot take care of this situation because it required a termination. So they had to send her to a hospital 3 hours away in Tucson, Arizona, where the nearest place where she could get the kind of care she needed. And so I do think there's this idea of, you know, do no harm to who? And in so many cases, you know, there really isn't anyone being, if the argument was going to be that they were saving this fetal life, many times that's not even the case. I feel like now I'm thinking about the woman who spent, 62 days hooked up to ventilators while she was unconscious, brain dead. And it was just because these anti-abortion extremists insisted that her child be given a chance to develop. She was like in the start of her first trimester. Like there was this, and there was just nothing that was going to come of this except really making it clear that, you know, do no harm unless it's a woman's life, unless it's someone's life we don't see as valuable. And I think it's also interesting to know that just in the context of the idea that a lot of these modern attacks on contraception and abortion don't have a long history in the church, and a lot of them started emerging during sort of the second wave of feminism. I think that a lot of this does come down to that the Conference on Bishops happens to be a very male-dominated body of people, and that they're interested in upholding a certain power structure.
Right. You know, it's interesting, the case you refer to, Maria Munoz in Texas.
Yes, thank you.
The Texas court ruled that, the law in Texas, the court finally intervened, but the law in Texas was that this unborn child took precedent. So basically, the law was that she had to serve as an incubator. She was I believe she had an aneurysm and was unconscious, but she had to serve as an incubator. But let's, you know, our listeners really need to know what it means when you're turned away at a Catholic hospital. So, Amy, can you tell us some of the stories about what has happened? I mean, we're talking people who were sent home hemorrhaging.
Mm-hmm. Right. I mean, the case that I mentioned in Wisconsin of the doctor who, you know, had to sit and watch her patient get sick, you know, in that case, a doctor is really faced with the dilemma of, you know, discharging this patient and maybe quietly telling them, like, go to another hospital, you know, or trying to arrange some kind of transfer by ambulance to a hospital where they can get better care, or, you know, trying to keep them in this Catholic hospital where they have to wait for them to get, you know, seriously ill before they can help them. And this doctor, who, you know, was a kind of a whistleblower for, you know, this situation she was placed in, was like, how do you tell a patient, like, I'm waiting for you to get sick. Like, you're fine now. Like, it'd be much better if I could help you now, but I have to wait for you to get really ill. Like, how do you tell that to a patient? It's antithetical to everything that medical providers learn in their training. And so this doctor had made a point of, you know, when she trained other future doctors, of telling them, this is not the standard of care. We can't do the standard of care in this institution. Here's the standard of care. I'm going to tell you about it, but you're not actually going to learn it. You're not actually going to see it. And so I do think there are people within these institutions who are trying their best to do, you know, the best work and take the best care of patients that they can. But yeah, we have seen cases like the Tamisha Means case that Kira mentioned earlier, where patients have been sent home while bleeding, while in pain, while in the potentially life-threatening process of losing a pregnancy, where if they start to spike that fever and get that infection at home, you know, people have died from this. Like, let's not forget that. And we don't know how many people have died in this country. We don't have those numbers. Or, you know, we know anecdotally that plenty of people have gotten really ill because they've had care delayed or they've been turned away home by one of these Catholic hospitals. But we know that in Ireland, Savita Halappanavar died because she was in the process of miscarrying. She was denied an abortion. a medical provider told her Ireland is a Catholic country, and that was it. She got a severe infection and passed away, and that incident kind of catalyzed this pro-choice movement sweeping across Ireland, and a level of change there that couldn't have been imagined a few years ago. But I think it's really important to remember that those are the stakes here. And if I could just return to a previous point about the charity care issue and this idea that Catholic hospitals take care of more poor patients, I think that's actually a myth. I mean, Kira's research has showed women of color disproportionately deliver in Catholic hospitals, and I think that's really important to note. But Merger Watch crunched the numbers in 2011 and found that Catholic hospitals actually provide less charity care proportionately than public hospitals. Public hospitals do a much better job and take care of more poor patients. And when it comes to Medicaid patients, Catholic hospitals actually provide the lowest care proportionately to patients of any other category of hospital. So just to say that, historically we may think of these hospitals as being, run by nuns who, cared about tending to the poor and were really mission driven. But now, Sivi, as you mentioned, these are really massive corporations that are interested primarily in their bottom line. They just happen to also follow these, draconian religious restrictions at the same time.
They're revenue generators for the church. I would like to point out that the tragedy of Civita in Ireland is what did serve as the catalyst for the reversal of the abortion ban, and that the unfortunate tragic experience of the woman from Sierra Vista, Arizona, who had miscarried one twin and had to terminate the other and be driven by ambulance 3 hours, that did put an end to the merger. Because the community, it was a trial, it occurred during a trial phase when the community hospital was being taken over by a Catholic healthcare entity. And they had a window where all the paperwork was not finalized. And it was during a trial period, and that provoked the community outrage where that merger was off the books. So that leads me to ask, as we have a bit more time here, not much. Our listeners and viewers have heard these horror stories, and they've heard about the high rates of harm and maternal mortality and the high incidence of harm, danger. Let's address two things so they don't leave here unarmed. Number one, what can individuals do to protect themselves if your provider is affiliated with or indeed Catholic healthcare itself? What should you be on the lookout for? Kira, let's start with you, because I know in your report you do mention some recommendations here.
Yeah, I mean, as far as individuals, one thing they could do is just ask questions when they go to a hospital. If it's not clear if it's a Catholic hospital, then they could ask if they practice any type of religious refusals. But I think the main issue is the fact that, just like we said earlier, a lot of people just don't even know about these refusals. So if we want to talk about what the community at large could potentially do, one thing is just to community groups or even individuals themselves can go about educating people in their community, particularly if you're in a community that has a Catholic hospital, educating people about the ethical religious directives. Keeping your ear out to find out if your hospital is going to merge with a Catholic hospital, because if it's going to merge with a Catholic hospital, then there might be an opportunity to go there to work with community members and elected officials to try to stop the merger, or to make sure that there's some type of carve out, so maybe the OBGYN unit doesn't have to follow the ethical and religious directives. And Merger Watch has been great in helping community groups work to try to push such policy reforms through.
I do want to interrupt to say that we should should tell people Merger Watch happens to be an organization that monitors Catholic healthcare acquisitions, buyouts, and mergers. And they do have a website, and they very readily have information on their website about what's happening. And so they have been a source of information for the country, for those who want to listen to what's happening.
Yeah, and I'll end by saying, like, I think the biggest barrier that advocates have been facing with trying to really shed light on what's going on with Catholic hospitals is that a lot of patients don't even know when they're refused care that they're refused care because of ethical and religious directives. Like, for instance, in your documentary, you featured the story of Lori Bertram Roberts, who was refused care at a Catholic hospital when she was very young, I believe like 16. And she didn't know 2 years later that she was refused because of the directives. Because a lot of times, especially for people who are used to being discriminated against, women of color, a lot of times when you just treat it in a discriminatory manner, you don't even realize that this is wrong and it shouldn't not have happened. You just take it as an everyday incident, and you don't think to act out or say anything about it. So I think a lot of women who are refused care at Catholic hospitals, they don't know that it was wrong and they should say something about it and speak out about it. Yeah. And another thing is doctors, actually. We're trying hard to get stories from healthcare providers about patients that they had to refuse care and that they thought it went against their professional standards of care, and they were upset about it. But a lot of healthcare providers are afraid to speak out because they're afraid of either being retaliated against by the hospital that they work at, or either by their colleagues. But sometimes, or
losing their job.
Yeah, losing their job, or having their colleagues upset with them because they spoke out against these refusals. So yeah, so it's hard to get stories. So the big thing I think that we're all trying to do is just get the word out there about these directives. Right. Try to get people to talk to us about what they're experiencing at these hospitals.
Absolutely. Amy, would you like to?
Absolutely. I mean, and so many people have personal stories about what's happened to them at Catholic health systems, and they don't put two and two together, like Kira was saying, until they realize, because it's not like these hospitals say, we're denying you because of the Catholic ethical and religious directives. It's not always that clear. But every time I post one of my stories, I end up getting a flood of feedback on Twitter from people saying, this happened to me, this happened to someone I know. So, tell us your stories, continue sharing these stories with people that you know so that they understand. 1 in 6 women in this country, according to one study, said a Catholic facility was their go-to place for reproductive health care, but more than a third of those people didn't even realize that the hospital was Catholic. So there's still a huge information gap that we have to overcome here. And honestly, a lot of that is on us as journalists, myself and other reporters and filmmakers. I mean, the media does not always mention this. For example, the New York Times did a big, horrifying story, really harrowing, about rural hospital closures last summer, and about this woman who had to travel 100 miles while in labor to deliver at the nearest hospital that had an OB ward that was open. What they didn't mention is that the hospital that she went to, that was 100 miles away from her home, was Catholic. And I thought that was a pretty important detail, right? Given that if she was in preterm labor, what if the fetus wasn't viable? Unless it was a pregnancy with no complications, that could have been a really scary situation. And I think people need to know that. So, pressure journalists, if you see a story that casually mentions a Catholic hospital without mentioning what that means, leave a note in the comments section, and pressure public officials, I would say too. For example, there was a big merger just recently between Catholic Health Initiatives and Dignity to create one of the biggest Catholic mega giants. And they did get some requirements from the California Attorney General's office in terms of being able to protect the current level of reproductive health care in those facilities for a certain period of time after the merger. And I think those are all a result of community mobilization and awareness raising.
Carmen?
I feel like I'm going to sound like a broken record, because this is I feel like the best thing that we can all do is just get involved in making sure that we're electing people who will actively do a lot of this. Like, the stuff that we're talking about is so important, but then there's also this entire missing layer of lawmakers at the local, state, and national level should be looking out for this. It should not be on, it shouldn't be a burden that we have to carry to tell our friends, that's a Catholic hospital, don't go there, this is what they do. Our lawmakers really should be enforcing the standard of care and making sure that no one is exempt from that standard of care. I did find it interesting, Kira had talked about trying to just really create these public notices and the pushback that groups have seen, because, a lot of the way that the church also stops people from accessing comprehensive care, these fake clinics that they set up in, typically poor areas and areas where there's not a lot of abortion and comprehensive reproductive health care clinics. And they're very deceptive. And they too have pushed back against laws that require them to literally hang a placard that says, we don't provide abortions, which is a fact. But they, again, are saying it's infringing on their freedom of speech, that it's somehow a mark of shame, which, I mean, it is. It's also a declaration of the fact we don't provide these services. So I think it is true that we all need to be vigilant. When you're calling to make an appointment, you should say, by the way, do you guys offer birth control and abortion care? Because that's a huge red flag and a very easy way to find out what kind of healthcare facility you're going to. But I also think, the elections are coming up. It's something that everyone's seeing, like these abortion bans are connected to these kinds of Catholic policies about rights of refusal. So much of this is interconnected. And the reason that these attacks on Title X and Medicaid and the global gag rule and the domestic gag rule stand is because we don't have enough force in politics. And it is interesting to know that this could be a city council issue, because these are the kinds of elections that we know people are less likely to pay attention to. So it's just, the entire ballot totally matters when it comes to women's lives and reproductive health care.
From the bottom up. But as we're about to wrap up, I would like to say that individuals must be vigilant over their own health care. You must ask your doctor, will you provide birth control? Will you, if I become pregnant and it's a non-viable pregnancy, what will I do? Will you help me? Find out. People in communities need to demand that their hospitals post a list of the procedures they will not do. Like a patient is a consumer. And as such, you need to appeal to, and we, as our impact campaign for the film generates more momentum on Catholic healthcare, we are going to be asking people to send letters, to sign letters to the attorney generals in every state, because one of their jobs is to protect consumers and provide consumers with information and protection. The other thing I want to say that everybody should go to our Facebook page, Birthright Film on Facebook, because we are launching today a petition to stop Catholic healthcare from endangering women's lives. And if you read that petition and you sign it, it is directed to the Congressional House Committee on Energy and Commerce. That is the committee that did issue the directives that people begin to follow maternal mortality and study it and investigate the number of incidences. And so we want this committee to begin to demand oversight on Catholic hospitals. So you have to be, as patients, you are consumers, you must be vigilant. You must, as citizens in the community, monitor what's coming into your community. Go to your city councils, go to your county boards, talk to your state health departments, to your regulators, and demand accountability, because your life literally depends on it. And with that, I would like to thank our panel, Kira, Amy, Carmen, and thank all of you for joining us. Please monitor your own health care and do not lose control over your own medical decisions. Thank you for being with us, and good night.
Thank you.
Bye.
Thank you.